Hi friends, welcome to Pharmacology. So from today's video onwards, we are going to discuss some pharmacy exams multiple choice questions with their answers. So starting with today's first question, the following structure is a hormone. It would be classified best as the options are an estrogen, a progestin, an androgen, a gonadotrophin, and adrenocorticosteroid. So here the correct answer is option A, that is an estrogen. This is because in here the ring A is aromatic because the only type of steroidal hormone that has an aromatic A ring is an estrogen. This structure represents an estrogen. Other structural characteristics of estrogens include the fact that the structure contains 18 carbon atoms. Thus, it is an estrane and contains a beta alcohol group in position 17. Hence, the structure is option A, that is estrogen. Next question. All of the following substances are endogenous tropic hormones secreted by the pituitary gland except options are somatotrophin, human chorionic gonadotrophin or HCG, then follicle stimulating hormone or FSH, thyroid stimulating hormone or TSH, then adrenocorticotropic hormone or ACTH. So here the correct answer is option B, that is HCG or human chorionic gonadotrophin. This HCG is produced by placental tissue and serves to stimulate the secretion of progesterone during pregnancy. Growth hormone, also known as somatotrophin, then FSH, TSH, and ACTH, are all secreted by the anterior pituitary gland. Which of the following glucocorticoids produces the least sodium retention? Options are cortisone, hydrocortisone, prednisolone, dexamethasone, fludrocortisone. Correct answer is option D, that is dexamethasone. Glucocorticoids have varying degrees of mineralocorticoid activity. This mineralocorticoid activity, which can result in sodium and fluid retention, can be blocked by the introduction of a methyl or hydroxyl group in position 16 of the steroidal nucleus. Dexamethasone has a 16 methyl substituent. So, because of this, out of this following glucocorticoids, this dexamethasone produces the least sodium retention. Which of the following insulins can be administered intravenously? Options are regular insulin. The brand names are given in the brackets. That is Humulin R. Then isophane insulin. Brand names are neutral protamine Higdon, NPH insulin, then Humulin N. Next option is insulin Lispromix, then insulin Glargine, insulin Glulysin. So here the answer is option A, that is regular insulin. Most insulin preparations are suspensions. Thus, they contain particulate matter. Only clear solutions may be administered intravenously. Regular insulin, which consists of water-soluble crystalline zinc insulin, is therefore suitable for intravenous administration. Insulin aspart, brand name Novolog, is also approved for intravenous administration. All other insulin preparations are normally injected subcutaneously. Next question. Which of the following classes of compounds directly stimulates the release of insulin from pancreatic beta cells? Options are progestins, biguanides, alpha glucosidase inhibitors, DPP-4 inhibitors, that is dipeptidyl peptidase 4 inhibitors, sulfonylurease. Correct answer is option E, that is sulfonylurease. Of the five classes of compounds listed, only biguanides, alpha glucosidase inhibitors, and sulfonylurease are used in the treatment of type 2 diabetes mellitus. These classes provide their beneficial effects through different mechanisms of action. Biguanides, for example metformin, enhance the peripheral use of insulin, suppress gluconeogenesis, and are often referred to as anti-hyperglycemic agents. Alpha glucosidase inhibitors, for example acarbose, decrease the absorption of glucose. Sulfonylurease and the structurally unrelated compounds such as repaglinate and nataglinate stimulate the secretion of insulin from pancreatic beta cells. So, hence the answer came as option E, that is sulfonylurease. Examples include glibenclamide, glimepiride, glipizide, etc. So, that's all for today. We'll continue in the upcoming videos. Thank you everyone for your support. Have a great day.